natural approach to ADD and ADHD without using drugs? The answer is yes. When individuals confront the challenges of ADD and ADHD, they often encounter treatment pathways that fail to address the multifaceted nature of that condition. Traditional methods typically involve medication to manage symptoms. It's supplemented by behavioral interventions. However, this approach overlooks the underlying neurologic, metabolic, and structural imbalances that contribute to the ADHD problem, leaving individuals and their families seeking a more comprehensive solution. And that's where the TriWell Plus ADHD Restoration Program comes in. Our practice pioneers a paradigm shift in ADD and ADHD treatment through the TriWell Plus ADHD Restoration Program. With a success rate exceeding 90%, our program takes a holistic approach, addressing the root cause of the ADHD symptoms. To promote a lasting transformation, instead of focusing solely on symptom management, we aim to empower individuals to thrive in all aspects of their lives, from academic, social, emotional, etc. With the TriWell Plus system, we look at the person as a whole. The system is based on the fact that we have a mental, emotional, and spiritual side of who we are, metabolic or nutritional side, and the structural, physical side of who we are. By looking at all three aspects of our health, nervous system, brain, and spinal nerve, metabolic system, the gut, toxicity, and deficiency, and the structural system, the bone, the ligament, and the muscle. By looking at all three aspects of your health, you can find the root cause of what's going on. When you find out exactly what's causing your problem, it is much easier to find a solution. And it's easier to be committed to an action plan to get better when there's scientifically proven treatments to reverse the root cause of ADD and ADHD. Unlike traditional methods that focus on symptom relief and not correcting the root cause, the TriWell Plus system delves deep into targeting the three main categories at the root of ADD and ADHD. First, neurologic. We examine the brain, the spinal nerves, the peripheral nerves, focus on restoring balance and function in the brain. Next, metabolic. We assess gut health. We identify leaky gut or intestinal permeability issues, inflammation, food sensitivities, biotoxin exposure, and nutritional deficiencies, and more. And finally, structural. We evaluate the bones, the ligaments, and muscles, ensuring supporting your body correctly. Now, alignment issues are a common reason for neurologic problems. Then we apply the correct therapy based on your test results. So the TriWell Plus model has a three-pronged approach. Neurologic restoration, where we dive into the intrinsic workings of the brain, identify neurodevelopmental patterns and areas of imbalance contributing to the ADHD symptoms. Using cutting-edge techniques such as neurofeedback therapy, we can rewire neural pathways to improve attention, focus, and impulse control. Metabolic optimization. We recognize the critical role of nutrition and the metabolic health in supporting brain function. By evaluating dietary habits, gut health, metabolic imbalances, toxicity, biotoxins, deficiencies, and more, we can implement targeted interventions to enhance nutritional status and promote overall well-being. Now, structural alignment. We understand that structural misalignments, particularly in the occiput and C1 areas, can impact neurologic function, allowing ADD and ADHD symptoms to develop. Through gentle structural realignment techniques, we address these underlying issues to restore balance and optimize the brain-body connection. A great example of how this works with all three aspects would be Ryan. Ryan's parents brought him to us because he was having a lot of the ADD and ADHD symptoms. He was only 12 years old, and I performed the TriWell Plus exam on him, and I found multiple problems. The brain is the primary problem with ADD and ADHD symptoms. When we perform acute EEG analysis on the brain waves are not registering the way that they should. The acute EEG showed classic ADHD abnormalities. Metabolically, the gut is related to the brain through a gut-brain connection. Neurologically and structurally, we look at occiput and C1, and often that's part of the problem. In his TriWell exam, it revealed he had problems in all three areas, neurologically, metabolically, and structurally. We went to work applying the proper therapy based on his exam, and after the treatment program had ended and we did the exam, everything went back to normal. The best part is not how the test got better, and that was great. But after testing, on the way out of the office, I asked his dad what he had noticed different with his son. And he said now his son smiles a lot. And I asked Ryan, I said, what have you noticed and what's different for you now? And he said, I'm actually happy now. I get teary-eyed when I think about this. He was 12 years old and really hadn't known what happiness was. But now he got his life back. Join the TriWell ADD ADHD treatment revolution. So say goodbye to symptom management and hello to life empowerment and the possibility. Welcome to the future of ADHD treatment. Welcome to our practice. We're transforming